Let's get on to the big policy issue now of the week. And despite all of the constraints on a minority government, this was a big deal, quite an achievement to get through the health changes. Rob Oakeshott had this to say about why he supported it.
I don't just slide across the line on this issue, nor has the government secured my vote in some sort of metaphoric headlock. Rather, Mr Deputy Speaker, I support this bill with a strong want that health ministers today and in the future of all political colours, state and federal, finally have the backbone to make health economics in Australia sustainable.
Now, Michael, George Megalogenis has described it this way. He said this is Labor's attempt to dismantle the Howard handout machine. Do you see it that way?
Well, look, you can make the case that this is winding back middle-class welfare. You can make that case. But I think you can also make the case, and Rob Oakeshott there talking about health economics, I think he went on to say that we really need to go a lot more to get a more efficient and sustainable healthcare system. Now, Tanya Plibersek there was basically talking about more spending on the public hospital system, as though this is an unalloyed good thing, and then a bit on the defensive about, our private health insurance rebates are going up, but they're going to go up a little bit less under us. It's not clear that this is genuine reform. Andrew Podger, former Secretary of the Health Department, wrote in the Financial Review this week, this is a pea and thimble trick that dresses up tax cuts as health policy reform.
Those who can pay should pay.
Well, are you saying that also about the childcare rebate? Are we going to means test the childcare rebate?
We have means tested, haven't we? Childcare rebate.
No, it's not a means test.
The baby bonus, sorry.
The childcare rebate is not means tested. And really it's moving away from more of the Rudd's Health and Hospitals report by Christine Bennett had the reform agenda in it. Do you move towards more of a system of choice and more competition, including with health insurance, with the funders and the providers? This is really locking up a system, and it cannot really be seen as genuine health policy reform.
I think that's the...
Oh, sorry.
I was going to say that's the long-term argument. In the short term, the argument hinged on whether this would force people to drop their private health cover. And I think looking at the historical evidence, what Tanya Plibersek was saying is probably right, that given that the stick that high-income earners pay if they don't have health cover has now been increased as well, there's not a lot of evidence that there's going to be any exodus from the private health system.
Yeah, they've
it's saving money and not changing the mix
They've got
so
people
much.
in a bit of a headlock in that the stick is so big.
A metaphorical headlock?
The stick is so big that you may not get... you may not get people a big exodus. You might get some other things happening there, and you will get, as people point out, a two-tier system. You will get people locked. The middle and upper will be locked into because they're forced by the government really to go into private health insurance and the private system. And there are some quite ironies in the way that the health policy is going.
I don't think it's reform, but I do think it was bad policy initially. It was just billions and billions of dollars handed directly to the private health insurance. Ask any consumers. Not a lot of people think they get great service or value out of their private
Well, it's an
health
over-regulated system. It's a poorly regulated system, which means the competition is not as pro-consumer as it should be.
I think it was always too generous, always flawed. I agree with you that doesn't make it reform, and reform still needs to happen.
Well, is it over-generous in that people who take out private health insurance, of course, are paying a big Medicare levy? Now we've got a sort of surcharge on a levy, so it's getting very complicated. They're not spending on the public health system, they're spending more on their own private health.
But when you see, as we did this week, the woman standing in the driveway, the mansion in the background, and having a whinge because she's lost about a $300 rebate or something, I mean, do you really buy that?
On a family income of more than $250,000. I mean, you've got to ask at what point do we not... It's not...
Well, are you saying that about the childcare rebate?
Well, I would say it about the childcare rebate.
No one likes having money taken away from us, but it doesn't mean we can afford as a nation.
And just saying that there's one unmeans tested benefit doesn't mean that taking the means test off another isn't a justifiable thing to do.
It means we're selective about when we do it.
Yeah, and Labor has selected 3 so far. Will it keep going? I don't know.